Always perform hand hygiene with soap and water or alcohol-based hand rub. Ensure hands are dry. The trained observer will ask you if you've completed your mandatory hand hygiene training.
Great. Do you feel ready to start?
Yes, I feel ready to start.
Okay.
Put on fluid-resistant, below-knee boots and tuck your scrubs inside. One size bigger than your usual size makes this easier. You can do this standing, but if you have a clean chair or stool, it's easier and reduces the risk of falling over. Put on the FFP3 respirator mask. This should fit well with no gaps around the edge. It's important that you have been fit tested for the type of FFP3 respirator you are using. Put on your hood. Some types need fastening at the front. Ensure a good fit around the face and jaw with no gaps and that it overlaps the FFP3 respirator mask. Perform hand hygiene again. And put on the nitrile gloves. Put on an impervious long sleeve gown and secure using the Velcro at the neck and tie at the side. The trained observer will help you check that there are no tears in the gown, that it's tied securely, and that the hood and inner gloves are well tucked inside. The gown should be long enough to cover your boots by around 10 to 15 centimetres. If you can't achieve this, you need to put on a longer gown. Put on the next pair of gloves. It is a good idea to secure with 4 strips of microporous tape placed lengthways. Put on a long length, medium thickness apron. Break the neck loop at the back and the trained observer will help to tie it. The apron is tied at the waist and neck. This helps to achieve a high fit to protect the chest and neck from any risk of exposure. Put on the visor or face shield and check that the band overlaps the hood and that no skin is exposed anywhere along the jawline. Put on your outer short length nitrile gloves, and if you are performing sterile procedures, you'll replace these with sterile gloves in the patient's room. Heavy duty gloves may be used instead of nitrile gloves for cleaning tasks.
Okay, do you feel secure? Are you ready to go in?
Yes, I'm ready to go in.
Okay.